I'm sure you had a headache at least once this year, isn't it? Don't worry, you're not alone. In fact, headache is one of the top reasons for a doctor's visit. As a neurosurgeon, I see several patients every day with different types of headache. I thought of making this video and shed some light on headache. Stay till the end, friends, where I'll be sharing some excellent time-tested home remedies for headache management. Hello friends, welcome to Doclogues channel. I am Dr. Arun Naik, a doctor for 30 years and a neurosurgeon for 20 years now. Dialogue with your doctor is called a doclogue. In this channel, we have doclogues related to brain and heart health, lifestyle diseases, cancer, spine health and preventive health. We also give here simple, effective tips and tricks to put you on the positive side of your health. With that said, let's get started. Well, there are more than 150 types of headaches we see in our clinical practice as neurospecialists. But I want you to know only the top 5 varieties of headache which are very often seen. Number 1, tension headache. 2, migraine. Number 3, cluster headache. Number 4, sinus headache. And lastly, secondary headache. Number 1, tension headache. Tension headache is the most common type of headache in adults and occurs commonly in women. This headache is like a tight band around the head. They are caused by a tightness of muscles in the neck and scalp. Poor posture and stress are often the offending agents. Tension headaches usually last for several minutes, but in some cases they can last for several days. They also tend to be recurrent. Number 2, migraine. You all know this term migraine. Migraine headache is again more common in women and often starts in teenage and lasts till about 50 years of age. It also runs in some families. It's pounding, throbbing type of pain, usually on one side of the head. It lasts from 4 hours to 3 days and usually comes a few times in a month. Along with the pain, people have other symptoms such as extreme sensitivity to light, noise or smells and stomach upset. What is the cause of migraine? Exact cause is still under research. Brain as such is a painless structure. There are a few pain-sensitive structures in the brain like the arteries, nerves and brain's covering. 50-year-old belief that the bulging of blood vessels in the head causes migraine is not accepted anymore. Scientists believe that there are some migraine-causing neurotransmitters called serotonin in the brain. Another belief is that brain and nerves have abnormal electrical discharges causing migraine. Let's go to type 3 headache, that is cluster headache. It's called cluster headache because it comes in clusters or groups. Cluster usually lasts for about 3 weeks to 3 months. Then headache completely goes and comes back again after a few months. Cluster headache is the most severe headache and this occurs 4 times more common in men compared to women. Hallmark of cluster headache is intense burning or piercing pain near the eye. The eye may be red and may have excess tear formation. Another peculiarity of cluster headache is running nose on the side of the pain. Let's go to type 4, that is sinus headache. Sinus headache is, as its name suggests, is caused by sinuses, which are air-filled cavities in the facial bones. When these sinuses are infected and blocked, you get a sinus headache. The pain here is in your cheekbones, forehead and on the bridge of your nose. Often there will be a stuffy nose, pain in the ears and fever during the painful episodes. Number 5, secondary headache. Here the problem lies outside the brain. This is due to some serious causes in other parts of the body. The commonest cause is high blood pressure. Hypertensive persons have headache whenever their BP is not under control. In fact, I have diagnosed so many patients with high BP when they first visited me for a headache. When I take their BP measurement, BP will be very high. We all know when we have fever, we have severe headache. Then there are some serious conditions like brain hemorrhage or head injury causing headache. Never neglect sudden severe headache associated with vomiting. When to see a doctor for headache? There are 3 situations, friends, you should never neglect and should seek an immediate consultation. Number 1, you have a long-standing headache, no issues, but when your headache changes its character, never ignore, see your doctor immediately. Number 2, when your headache is accompanied by loss of consciousness, vomiting, double vision, squint, fits or weakness of the limbs, it means there is some serious brain disease. Number 3, you should see your doctor early if you get continuous headache for a few weeks, especially if the headache is increasing in severity day by day and more during morning hours. Now, how to diagnose the headache? When a patient comes to me, I take a detailed history of the pain. Most headaches can be diagnosed by history only. Headache trigger factors need to be identified in each patient. In doubtful or atypical cases, I order a few blood tests. An MRI or a CT scan is ordered very rarely if the headache is not responding to medications. Now, what is the treatment for headache? Most headaches can be treated with combination of medications, and these medications need to be taken for years, sometimes lifelong, with a few breaks in between. Usually these medications are well tolerated and are time tested. As I told earlier, I will give some excellent home remedies for headache, friends. First is diet. Foods play a vital role in preventing migraines. Many foods and beverages are known migraine triggers, such as hot dogs, bacon, sausages, chocolates, cheese, and other dairy products containing naturally occurring compound called tyramine. Alcohol, especially red wine, is supposed to be a strong migraine trigger. And be careful next time when you indulge in your favorite Cabernet Sauvignon. Ice cream, processed foods, dried fruits also are migraine triggers in some patients. Make sure you get enough sleep and rest from your hectic work schedule. Yoga is an excellent solution for chronic migraine sufferers. I always recommend yoga for all my patients, and my patients tell me that their headache gets better with daily practice of yoga. Yoga is shown to reduce the frequency, the duration, and intensity of migraine headaches. Smokers, please reduce and better stop smoking over a period of time. Keep a realistic target of 6 months to kick the butt. Lastly, coffee lovers, watch your intake, because coffee may relieve a bad headache but in the long run becomes a main trigger for your headache. Watch my videos on lifestyle changes needed to tackle your headache. To know more about headaches, food to avoid, treatment and prevention, please watch my other videos in headache series on my channel. With that, friends, we have come to the end of this video. I hope you liked the content presented. If you liked it, please give me a big thumbs up. Please like and share this video with your near and dear ones to put them also on the positive side of their health. If you are new here, please consider subscribing to Doclogues. Hit that bell icon to get instant notifications of my new videos. If you are a headache sufferer, please leave your thoughts in the comment section, as in how you were able to cope up with your episodes. If you have a tip of your own which I have not covered in this episode, please mention it in the comment section. I'll be back with another interesting Doclogue very soon. Till then, feel awesome, live awesome, and take good care of your health.
Just follow me and take my hand. I'll show you things you won't regret. So close your eyes, I got something special for you. 'Cause I